Highlight our expert panels and discussions. I have Artur Pruszko with me, Director of eHealth Forum, who is the mastermind of this conference. Artur, before I give the stage to you, please tell us very briefly what is the leitmotif of today. Well, this day is dedicated to effective and efficient implementation of digital solutions or digital transformation. There are several leitmotifs, so let me just quote a few. They will be tackled during consecutive sessions. We are going to zoom on AI, automation, promotion of innovative solutions. The world is now driven by AI-generated decisions, by new technologies. Later, we'll think for a minute, what's the impact of the popularity of medical devices or usable electronic that has become medical class equipment and guarantees robust and reliable measurements. We'll also focus on introduction of apps, mobile apps, digital therapeutics to the healthcare systems. Many patients are benefiting from it. It's not regulated. It's not really deeply rooted in the healthcare system. There is a separate session to address this topic. And later in the afternoon, we'll have a discussion on digital health ecosystem. So very briefly, to give you a glimpse of what's coming up next, I'll give the floor to Jacek Bigda, Deputy Dean of the Medical University of Gdańsk. Hello. Jacek Bigda is one of those few people who many years before, together with us, have noticed the potential of e-health. And you saw it as a chance to transform the healthcare system because it puts the patient first. It highlights the status of medical professionals and their role, and it's also building our medical community. To nurture the culture of cooperation. So I have a question to you. How do you see this change? How do you evaluate this change looking back? What are the milestones of this transformation? What will stay with us after the crisis? Well, thank you very much. I'm looking back on, I've been looking back on e-health issues for several years because together with Artur, we've been working together also to advance this topic in our medical community. Well, today we see an explosion of ideas, how to harness new technology. But this is only a tool. This is a tool that will never replace collaboration of the medical professional and the patient or entire teams supporting the patient. So we should perceive health as a comprehensive set of tools and technologies meant to help the patient become the pivotal part of the system. And there is a huge team which is a cross-disciplinary team looking after the patients. What we have noticed recently is introduction of different services or products that need to be coordinated, that need coordinated efforts of different experts. They are driven by tools which are not always the best, but they definitely make our work easier. And they also fit this complex perspective of e-health. Very little time and attention has been paid to date to comprehensive care provided to patients not suffering of a single disease, which is financed as a specific product, but a patient hit by multi-morbidity, whose condition may change. These are cases when competencies on the team are highly complex and when different technologies and tools need to be applied. I think recent years have vividly shown us that different tools and technologies mentioned by Artur are able to facilitate migration of health information using mobile technologies or products that provide us with vital information on certain parameters. Integrated patient care is essential because patients suffering of a number of diseases are becoming more common than ever, and we need to have an economic choice. We need this magic button, which economically effectively will provide us with information about the patient's health status, which will be essential for primary care, for welfare and outpatient care that should be delivered in cooperation with the hospital. This is what is still missing within the Polish framework. We have focused on primary care. We have focused on such services like electronic prescription or electronic referral or e-health records, but there are tools which are able to help us, provided we have the right algorithm for provision of care to certain patient groups. And we still have a long way to go.
Well, thank you very much, Professor. And then thank you for pointing out that we need new skills, new competencies. All of these services are delivered by people. So they need to be skilled, they need to be competent, and of course, all of this needs to be coordinated. Well, thank you very much for your opening remarks. We still have a long way to go.